Well, the Vet Fam, what's up? We're back with another episode, but nobody's being called an asshole today. No, am I the asshole? Is my dog the asshole? None of that. So, what we're talking about today is a highly controversial role that has emerged in veterinary medicine, the veterinary physician's assistant role. So, Joyce posed a question to you guys, I believe it was yesterday, about your thoughts, feelings, and considerations on this. Some people have heard of it, some people haven't. Colorado State launched the program up at the university, and they were the first ones to recognize that that's going to be a position in their state. There are a lot of people that are on the fence about it, a lot of people that object it, some people that are for it, and I know that they're looking to bring that role to the state of Florida, and we are trying to fight that very vigorously because it's not something that we support. So Joyce, tell us what the TikTok is saying.
So the people of the Tickety Talk, as a majority, was against it. I feel like I won't even say on paper because we're going to dive how much of a difference because of how I'm going to digress in a second. I think making it sounds like a cool position, but in reality, people that have been in veterinary medicine see the writing on the wall that says that you're not going to get paid what you deserve for having said position, that half, and I won't even say half, because I would say the majority of the people don't utilize their licensed veterinary technicians to the fullest that they can. And honestly, they're not going to get paid. I don't know what nurse practitioners in the human side make, but I can guarantee you this position wouldn't even come.
No, probably not.
So
Even with
so
the lack
and
of
so
school.
like the people that were really for it weren't in veterinary medicine, and I now put myself on the outside of that in a sense that I could see on the outside looking in how it could be utilized, but as a past former walked away from washed up technician here knows that they would not be utilized to the fullest of their capabilities. But then also, like, we're going to dive deeper, and I may be jumping the gun on this. They're kind of already being set up for failure
Yeah.
because you already have, so like, okay, so Colorado, Florida. Florida is already saying hail no, and Florida doesn't say hail no to a lot of things because Florida is Florida. They kind of say yes to everything because it's a wild state. And Amber, you were telling me just what the schooling was going to entail.
Yeah.
And then I pulled up the human side, and my brain already started ricocheting on discrepancies that it's going to cause.
So I feel like, would it be nice to have a veterinary physician's assistant role? Absolutely. But I feel like that's where your bachelor technicians come in. Your credentialed, your CBTs that have taken that extra step to bridge the gap to be able to help, right? But you've got
Yeah.
these physician's assistants who are going to be handing out diagnoses. They're going to be doing treatments. They're going to be, taught to do minor surgical skills or minor surgical procedures, but the education behind it, like we're talking about, is concerning. So I think that's one of the things, yes, the state of Florida wants to bring this on. However, the veterinary professionals in the state are more that I've come in contact with are against it because of the curriculum that surrounds this. Okay. So
Yeah.
Colorado State University is the only university, to my knowledge, right now that offers curriculum for this, an actual a program for it. So your veterinary physician's assistant program is 3 semesters online. Okay, so that entails your anatomy, your physiology, principles of radiology, and ultrasound. It's not very much practical experience, right? Then you've got your 4th semester is in person to do your diagnostics labs, your clinical skills, your communication, surgery, dentistry, things like that. And then you have a cumulative final at the end. That's one semester, and you're going to turn somebody loose to do dentistry and to do surgical procedures with the majority of the things that they are learning online, not with real world practical experience, right? And then your 5th semester, not year, your semester, okay, is training in clinical procedures and applications of the things that you've learned, integrating principles, communication, teamwork, and professionalism. To me, that is less than what we go through in tech school.
Mm-hmm.
That's less rigorous coursework than that of getting your certification. And you're going to turn these people loose to cut on people's animals, to make diagnoses and things like that with online training. Like, this
Yeah.
is me. When I heard that there was a VPA position coming out, because I've always said, yeah, we would probably need one, especially with the caseloads in the hospital, in the clinics, because unlike human doctors, veterinarians, right? Veterinarians do surgery. They see patient, like it's multiple species, this, that, and the other. Everybody gets it. There is a backlog on appointments and surgeries and things like that, but that's where you can utilize your certified veterinary technicians to the latitude of your state veterinary practice acts, right? That's where you would be able to utilize them instead of bringing in this VPA completely different, position. And they've got the real world experience, the training, the education, the knowledge, and things like that to do most of those things under the guidance of a veterinarian, with the exception of surgery.
Right.
I'm learning anesthesia and surgery online, and granted, your education is what you make of it, but I'm okay with that. I'm not okay with it. Like, I love the idea of the position, but again, your bachelor veterinary technicians, your ones that go through your CVT program and they advance themselves, those are the ones that we should be looking at as our VPAs and things like that, if such a position exists. You know what I mean? Not this, you get a bachelor's in science, or you get a bachelor's in this, that, or the other, and you go take 4 semesters of a master's program, and bam, you're working on animals. You're diagnosing, you're treating,
So
you're
pretty
cutting.
much in 0.2 years, that's it. In retrospect, to be like a nurse practitioner, they do an additional, after they have to get their bachelor's in nursing, so that's 4 years right there, right? They have to do an additional 2 to 4 depending on the specialty that they're going to kind of gravitate towards. That's 2 to 4, and that's not any kind of a practicum or anything like, well, it involves practicums because you have to do X amount per semester and stuff like that. But like, so 1 year, we're gonna shave off a practicum that you're gonna be doing versus 2 to 4.
Yeah, and
We're missing some steps. You're going, and it's not like Colorado doesn't think that they wouldn't have the people signing up for it, because we all know technicians that would, right? In retrospect, that they would want it, but none of them are going to be set up appropriately to do more than, like, they're going to be giving vaccines, honestly.
Yeah.
There's not going to be many places that are going to be utilizing the skill set that they do get, and I say get loosely, right off the bat in the first 5 years of them going onto the market.
Yeah. I mean, semester 4 is 416 hours of in-person training. Semester 5 is 540 hours of clinical internship. Like, I don't feel that that's enough to set these people up for it's a great thought to have this position, but it's scary. It's very
Well, you got
scary.
to stop throwing us to the wolves. Like, set us up for success for once.
Yeah, and two, like, we would be able to bridge the gap a whole lot better in vet med if we utilized our credentialed technicians to their full capabilities. They went to school, they got the education, they got the training. They are capable of more than doing callbacks. They're capable of more than working rooms and giving vaccines. Like, again, utilize them to the latitude of your state veterinary practice acts. Train them up, because they're not getting the hours, the pay, the benefits, the skill set, things like that. Take them and elevate them up. Make that a program for them to excel and for them to grow with, and not this shit. You know what I mean?
Yeah.
Like, I'm getting very upset and very passionate about it, because this is going to put a lot of patients at risk, and it is going to essentially devalue a credentialed technician position, in my opinion.
Yeah. Well, and do they even roughly have like what the pay is going to be? Because I can guarantee you it's going to be like $2 more an hour. And I keep going back to the pay because we're all having issues paying our bills.
Yeah. So I haven't seen anything in terms of salary, because again, the first graduating class of this mess is coming in 2027. So I don't know if they have a pay scale established for it yet. Just the curriculum is what I'm seeing.
I mean, I'm telling you right now, it's not going to be 6 figures.
No, absolutely not. You got veterinarians making less than 6 figures.
I was going to say, I was like, you don't even have veterinarians making 6 figures out there in the world.
Two, I don't know
you
why.
got techs making in the $40,000 range on average. So
Yeah.
maybe 50,000? That's not enough. That would not be enough of a. I don't care enough about titles to want that title.
No.
Mm-mm.
But, elevate your current credentialed technicians. Elevate them. Make that a requirement, for, or a curriculum, not necessarily a requirement, but curriculum for them to go through their CVT, their bachelor's, and then, your master's in veterinary medicine after you've done those things is where you reach that veterinary physician's assistant. You shouldn't be able to go get a bachelor's degree in some kind of bullshit, whatever science is, and then get a
Yeah.
master's in veterinary physician's assistant. Like, some people are probably going to rip my throat out over that, but it's not a good idea. I feel like there's different and there's better ways to go about it than what has been done, and again, I'm an uncredentialed technician. I'm like 3/4 of the way done with the tech program, and I switched over to CVPM because I make more money and it's less. I thought it was going to be less impact on my body, but when you get to be a PM, a CCC, and a technician, and a therapist, and a janitor, and everything else all in one, plumber, all in one fucking day, like, it's still hell on you. But anyway, I digress on that one. But I don't know. I'm almost done with it, but I believe wholeheartedly in title protection for these nurses that have went through school, that have sat for the exams, that have went through their bachelor's and things like that, and giving them a better career pathway and better job satisfaction. Because I have seen in lately some absolutely miserable CVTs because their skills do not get utilized to the best of their abilities. So why did I spend the money? Why do I have student loan debt? Because I'm not making shit for money. I'm not using my skills for anything but to do vaccines and TPRs. Like, what about those guys? What are we doing for them? So those are my thoughts on it. Not a good idea.
It's not, and I feel bad for the people that will hit that market when they graduate from that program and then
Yeah.
go into the setting. You know what I mean? Because they're not going to get the respect. They won't get the respect for a while. Um, they won't get the pay, and they will have people against them because they're in it to think that they're doing good and to elevate their career, right? That's their thought process, which at least is what would be mine, right? And when I went into vet tech school in Indiana, we were the first group to hit the market in that area and was met with all kinds of earthquake tests. Allie hit the thing. We were met with so much pushback from the veterinary community for being in there just in training purposes because they had mainly on the job technicians, right? Which honestly, we've gone through this. I'm a whole support advocate for them. They will have even more pushback because they're just it's not they're going to be set up for failure is the moral of my story because I'm going on a ramble, but like it's going to be set up for failure for many years.
And let's not talk about when these VPAs get in their positions in these hospitals. One, it's probably going to be mainly corporate. Corporate is fucking veterinary medicine. I'm just gonna say that right there. Corporate has taken veterinary medicine to levels to where it shouldn't be and preventing access to care and all kind of shit. But we'll save that for another episode. But when they get into these corporate practices or they get into practices in general, who do you think is going to be training them? Your
CVTs.
CVTs, your OJT
Yeah.
technicians, things like that. Those are the ones that are going to be holding their hands. There we are. Yeah. So they're going to have somebody come in that's going to get paid more, that has less experience, that they're going to have to babysit and they're going to have to train while they're getting the shit end of the deal.
Well,
So,
and does it say on there like what their scope of practice is? Like you say, like I assume like we're talking like wound care and abscesses and dental extractions.
oh no.
Because like what's gonna be their scope of practice? Because
All right, their scope
let's
of practice, diagnosis and treatment. So VPAs can diagnose and treat common illnesses and injuries in pets, which helps alleviate the workload of veterinarians, right?
which nurse practitioners do that too.
They are trained to perform routine surgeries and manage backlogs of patients, enhancing overall the efficiency of veterinary practices and client communication.
So spays and neuters?
I would hope probably a lot of soft tissue, spays, neuters, tumor removals, things like that, dentistry. Yeah, I don't know if you're entropians, if you're, I don't know. It just says routine surgery, so what does that entail? You know what I
Yeah,
mean?
because like each practice has a version of what their routine
Right. Specialty
surgeries
of
are,
root.
and well, and people think a spay is a routine surgery, but no, it's considered a major surgery because you're going into the abdomen. So we're going to hopefully scratch that off the table and focus on neuters, please, and thank you.
So I don't know. Increasing demand for veterinary care. Let me tell you something right now. This is what it's supposed to be addressing. Veterinary medicine is suffering right now. There are
Hmm.
clinics that are closing their doors. There are doctors that are walking away from their practices because there are not enough. Yeah, there's enough pets, but not enough pets being seen, not enough appointments being generated, not enough, revenue being generated, and these places are shutting down. There's relief veterinarians right now who the relief market is saturated, absolutely saturated right now, and they're not getting a lot of shifts because there's not a lot of shifts to give, right? Who's going to pay a
Hmm.
veterinarian $1,200 to $1,500 a day to come sit in your practice for 3 appointments? It makes no sense. So why are we not doing more for our graduating veterinarians looking for jobs, our relief veterinarians looking for jobs, rather than focusing on this VPA position? It's really not a need right now. Maybe during COVID, pre-COVID, things like that. But right now, the way that the market sits,
It's not there
it's not there. It's not there.
unless you're at like at the universities or at a very, very busy
Yeah.
corporate emergency specialty place.
Yeah. And two, my question is, are these guys going to be able to do relief shifts under the direction of, say, the practice owner who's on vacation?
Right.
Are they stepping in to see their patients and things like that? I feel like this is going to go in a really, really bad direction, and there's going to be, I feel like, not necessarily that there could be, because I don't want to discount these people and their education and their dedication to what it is that they're doing, okay? But not everybody knows. Again, your education is what you make of it. You know what I'm saying?
Yeah.
But I feel like there's going to be quite a few malpractice issues because of things that are done, not out of malicious intent, just lack of knowledge, skills, and experience.
Yeah.
I think it's going to
Exactly.
set a lot of practices and a lot of licensed veterinarians up for some challenges legally. Those are my thoughts on the situation. I don't know. I told my
I
boss, I
just
said, if it comes to fruition in Florida, I might do it. I might do it. But I've been in vet med since Jesus was a fetus. You know what I mean? I don't know.
wouldn't do it if I was still in vet med
Yeah.
because one, I didn't get my bachelor's and I don't want to go back to school for that.
Yeah.
Just to do that and then not have the income to support. You know
The
what I
loan.
mean? Like they're not gonna get paid.
No, because veterinarians make shit for money as it is, depending on what you do. You
Yeah.
know what I mean? There's practice owners
Yeah.
right now that aren't even taking paychecks because they don't have the revenue to support them to take a paycheck and pay their staff.
Yeah. Exactly.
I don't know. I don't know. And these guys may end up in specialty facilities, emergency facilities, which is scary because I don't see that as a part of the curriculum. And that's really hard to shove into 500 and something hours of practical experience.
Yeah.
But I do see them in more corporate settings to offset the caseload for the corporate doctors.
Yeah.
I think that's who's driving the push for this. So those are my thoughts on the situation.
But if you guys have thoughts, drop a comment because we don't like this is happening. It already is happening and they'll be hitting the market next year. So let us know what your guys' thoughts are and we'll see you next week.
Yep. Take care, guys.